one of the things, as you can imagine, when it first hit, there was just a high degree of freneticism or like, what do we do? What's exactly happening? And so we made sure that we looked at this holistically across everybody that's impacted. So we looked at members, providers, brokers, employees, and then the community at large. Where was it that we could help plug in and not necessarily step on any of the other disaster recovery agencies that were out there, but really where could we provide value and additional help? Um, so that was kind of our first approach. We did stand up our business continuity team with a command center, and it brought together leaders across all the stakeholder areas to think about what are those ideas, what is the information that you're fielding, and where is it that we could plug in. So it was everything from making sure that we were reaching out telephonically to folks, but also being in person. So one of the stories that I can share from day one when this happened, we have something that we call Embrace. It is a product for institutional special needs. It's an institutional special needs plan, which assists those bedside who live in assisted living communities. Sadly, two of those communities burned and then 15 were evacuated on day one. So we immediately sent our clinical teams out into the field to help those folks and to work with local agencies to see where we could house and then still continue to provide the care and supplies that were needed. SCAN views itself as part of the first responder teams. And one of the things they always tell first responders is make sure that you're taking care of yourself first, right? Because you are only as good as what you can then provide to others. So we have made sure to stay very close to our employees, whether in the impacted zones or otherwise, because we're all impacted by the definition, by seeing the destruction, and by seeing what's happening to all those different stakeholders that we talked about. So making sure that we're talking about it, providing resources to our employees so that they can take care of themselves and then give to others. As far as for others, looking across a couple of things. There are so many resources out there that are available. So we're making sure to connect with and know what all those community resources are. And then as we encounter various needs, whether we're identifying them or we're hearing of them through outreach, we're connecting folks into the appropriate community resources. And then lastly, just knowing that this is a point of crisis in the most immediate time frame, just understanding how to navigate this kind of situation. You don't know if you lost your home, what do you do? Or if you're displaced, how long are you going to be displaced? Where to turn, how to pay for that? We're making sure that we've got our own resources to be able to make available to employees and members just to help talk through what that means to them and how to navigate it and what steps to take. This is certainly one of those instances where it takes a village, right? And we're very grateful for the strong relationships we have with both local and state agencies. We have partnered the Embrace team and the clinical team that had to help with the evacuations of our most vulnerable and high-risk members. The local agencies were so supportive in helping us make sure that there were places to take these individuals and allow us in to provide that bedside care and to bring supplies, not only for our own members, but for others that were displaced in these respite centers. We also partnered in like the city of our headquarters, just housing availability. Where is it that we can help direct when we know that there was a need, whether for employees or members or even providers, to make sure that folks had a place to go so that they could return to doing whatever it was they needed to do in the community. So again, just very thankful. It couldn't be something that we do alone or they do alone. I think when you come together, we're much better together.